Brooklyn Independent Television.
Hello and welcome to Brooklyn Elected Official. I'm Dr. Mathieu Eugene. Today I'm joined by Dr. Juliet Hudson, who had her own private practice specializing in women's health. Dr. Hudson, thank you so much for coming.
And thanks for having me.
And I know as a doctor you are so busy. And I thank you on my behalf and also on behalf of the community for taking time from your busy schedule to be here today.
Oh, absolutely. It's important.
And it is very important because we know that health is the most precious gift that we can receive from God. It is so important that the people know about their health, about the symptom, the sign, and a certain situation in which they have to contact doctors. And I know that today you are going to talk about obesity.
Correct.
Which is a very, very important situation. And our sisters or mothers or wives, and they have to know about this very important situation.
Agreed.
First and foremost, I want you to talk a little bit about yourself.
Okay. So, yes, my name is Dr. Juliet Hudson. I'm an internal medicine doctor, which means a regular primary care doctor, physician in the community. I am also an attending physician affiliated with Maimonides Medical Center. As far as my background, I am originally from the island of Jamaica. Grew up in Brooklyn, New York, so Brooklyn, New York is my hometown. I actually had 4 different careers. I was actually ex-military, United States Air Force. I did accounting and finance, and then I did nursing. And I was actually a nurse for about 14 and a half years, critical care and management, before I decided to go into medical school. So here I am today, practicing medicine.
Wow, this is a powerful and strong track record. Yes. Being a nurse, accounting, veterans. And let me tell you also, as you may know, and I know that you are aware of that, I'm the chairman of the Veteran Affairs in the City Council.
Which I'm very proud to hear of. It's good to have somebody behind us in the scenes.
Yeah. And both of us, we come from the island.
That's right.
Because I'm from Haiti, you're from Jamaica. This is what makes New York so wonderful. All of us, in New York City contributing to the fabric of this country.
Great diversity.
Yeah. So what can you tell us about obesity? And let me answer that some of them, they say obesity or overweight. Right. Is it the same thing, or is there any difference between those two?
So it is designated and is classified into a couple of different groups. First of all, the National Health Institute, along with the Center for Disease Control, did a statistical research study, and they said about 60% of the adult women are classified as overweight. A third of that group is classified as obese. So how do you classify obesity? Obesity is done by a calculation called BMI, which is the body mass index. That calculation is based on your height in inches divided by your weight in pounds, and that gives you a number. That number is further categorized into 3 parts. If you have a BMI less than 25, you're considered within normal frame for your height and weight. When you go from 25 to 30, you're considered overweight at that point. When you're over 30 to about 40, that number becomes obese. And if you go over 40, that's considered morbid obesity. What we tend to look at is different things of why somebody becomes obese. What are the factors that plays within this role? And there's a couple of things. One is definitely there's genetic component involved. There's also environmental and culture. People are used to going out now. They don't have time to cook a home-cooked meal. They don't have time to exercise. A lot of fast foods are being consumed. The biggest thing is calories, and the calories that they take in becomes empty calories. If you say that you're supposed to be like on a 2,000 calorie diet, let's put it in perspective. If you had a cup of lettuce, that's 4 calories. If you had a slice of cheesecake, that's already 890 calories. So you're already half done for the day of your caloric intake. And I think that's what people need to watch as far as foods and how they break it down.
Yeah, you mentioned several causes of obesity, but let's say genetics, for example, lifestyle and diet. But which one of those causes that people can modify or control? Because we know that in terms of genetic, I don't know if there are too much I can do, but what would you be your advice to the viewer in terms of preventing obesity or correct, the obesity situation?
It's going to be definitely lifestyle modification, and that's one of the biggest things. People tend to go for the quick fix. Everybody wants it instantly. And when I try to tell my patients, you didn't gain the weight overnight, you're not going to lose it overnight. You have to have a disciplined modality and think of it. Dieting at this part is actually a job in itself. You have to learn the right food choices, the food groups, and what works for you. People tend to have bigger portions than what they need, and what we try to tell them is to look at your plate and divide it into 3 parts. The plate should be divided in half, as that being vegetables. And we just don't mean just lettuce, tomato, cucumber. We mean the whole array of vegetables, meaning zucchini, cauliflower, spinach, collard greens, the whole spectrum. And so people get more fruits and vegetables in their diet. The other half of their plate should be divided in 2, which goes to the starches, and which is your rice, potatoes, pasta, and the other part into your meats, fish, lean poultry. And we try to say if you're selecting meats to do more of the lean cut meats and get rid of the fatty parts and components of it. Now, that being said, is that you don't have to get rid of fats. You do need some fats because your body do need fats to work on, but you have to choose the correct fats, the healthy fats, which is the monounsaturated fats and the polyunsaturated fats, which are naturally found in fish, nuts, and vegetable oils. So it's about making right choices of those type of foods, incorporating it in a daily lifestyle, and going forward with it.
Some of the time I heard people say that, I can eat everything that I need to eat or I want to eat. Later on, next month, I'm going to the gym. So what could you say about that? Is that an other or certain principle to observe in terms of diet, exercise, and lifestyle? Well, because people believe that they can put as many weight as they want, but I will get rid of it by doing exercise.
So where exercise come into play, because you could do 2-part components of it. The more activity you have, the more you walk, the more you exercise, the more you do some kind of stretching actions that way, you're burning off those calories that you're taking. So the physical activity increases everything else, increases your cardiovascular health, increases your insulin resistance, and helps decrease those comorbidities that comes with obesity in itself. As far as saying, okay, I'll purge or sacrifice this month, not go to the gym, and I'll have and go out every single night and eat what I want, and I'll make it up next month, you got to think in proportions and over time. It's not just right here, right now. It's what's going to affect you over time in the long run.
Very good, very good. And also, you mentioned that, but let me ask you that, what makes obesity such a very serious situation for women? Is that the amount of fat inside the body, or the effect or the impact of obesity on the health? What?
More so in health, and obesity over time could affect multimodal symptoms. So it could affect the coronary vascular disease, coronary artery disease. Fatty foods over time will lay the plaques in the arteries, give them more risk of heart attacks. It could affect blood pressure, weight and volume. Uncontrolled hypertension gives you more of a higher risk, 50% chance of stroke. It also increases the chance of arthritis. Your hips and your knees are your weight-bearing joints. When you become obese and morbidly obese, you're putting more pressure and stress on those joints and wear and tear over time. It also affects as far as some cancers as well, more prominently colon cancer. Hence the need of why we need to decrease the fatty intake and increase the vegetables, fruit, and fiber part. Definitely, I would tell any patient over time that yes, you would have to take your diet and weight and management seriously. That is just not a here and now. It's actually a lifelong process, and you have to be able to do everything in moderation.
I like that, moderation. Everything in moderation, because certain people have a certain tendency to eliminate, certain element in their diet.
Right.
Or they have a certain tendency to take pills or certain medicine to get rid of the weight, and finally they become sick also.
Right, and that's because they ever want to do the fast aspect, the quick fix, because they want to lose it now, lose it right away, and I could lose this in amount a certain time. And some of those quick fixes are very harsh on the body. And after the quick fix, you have to be able to maintain that weight. So it's not only a matter of losing the weight, it's actually maintaining so you stay in your weight frame for your height and your body structure. And you can only do that over time and discipline, okay? So it can't be just I diet for 2-3 months and then I could do whatever I want and start all over again. It's actually going to be a really, truly lifestyle modification of something you have to commit to. And it doesn't have to be that so strenuous. People think of it more astringent, and I think if they just look at the food choices that they've been taken in over time versus the food choices that they can improve on, it will become better.
Okay. In terms of, I wanted to put emphasis on that because you mentioned earlier that we need fat in the body also. So people believe that, fat is dangerous. I had to eliminate all type of fat. So, and by doing so, as I said a few minutes ago, they end up in the hospital, they become sick. Would you please put the emphasis on the importance of fat in the body? And you mentioned that, but I would like to our audience or our viewers to understand that it is not about eliminating everything, but as you said, by moderation, to have a balanced diet.
Correct. The body, when you deprive it of fat, goes into starvation mode. And your body needs a certain amount of protein, of fiber, of fruits, vegetables, vitamins, of fat to function and to live. If you eliminate the fat altogether, it's now burning good muscle as well as spilling off other things in the body. What you end up with is when you do take in the fat, the body holds on to everything, okay? So you have patients, you have clients who come in, they go into diet centers, they go into diet loss, and they can't figure out why they can't lose it. It's because the body is missing that part of component to function. And when you do take it in, it holds on, so it's holding on to the bad fat as well as the good fat. So what do you have to teach the patient? That there are good things as good fats, and it's usually those fats that are not solid at room temperature. So the vegetable oils, the olive oil, omega-3 fatty acids is natural in tuna as well as the salmon and fish and in your nuts. Right? So you can use those fats to give you and fuel your body what it needs and still be able to diet and do well.
So we're talking about fat. Would you please tell our viewers why certain fats are very dangerous for the body and why they have to eliminate or control the fat that they are eating? Because we know, there are relation between heart disease and other pathology in the body. Would you like to just give some few information about fat and certain disease? Sure. In terms of,
Well, with the fats, it's mostly is how it's metabolized and broken down. The monounsaturated fats and the polyunsaturated fats are easily digestible of just how the pathway it travels within the body. When you have the trans fats, they build up. And they build up and they line the arteries. And the arteries now become lipid Aladdin, so to speak, laid with fat, and it narrows this flow. So now a nice vessel that you had before is now blocked with cholesterol plaques. That cholesterol plaques could build up. It can make the artery more stenosed, narrow, have a harder chance of the blood flowing through, give them more risk for coronary artery disease, heart attacks, and stroke.
So, I don't want to go to the detail, but I think it is very important for the viewer to understand the mechanism of those pathology of the importance of what you are saying, because you say that because of the fat, they can get coronary artery disease, the blood flow can reduce, and I don't know if you would like to mention and to say some few words about what is the risk and the danger of having the blood flow reduce, because we know that the blood goes to all part of the body.
Right.
Yes.
So, the most important is that everything is perfused. And if we're talking about the heart doesn't know where it's losing the blood from or not getting the blood or able to oxygenate. It just knows it doesn't have it. Over time, it tends to work harder to make that demand met. Anything where you're putting more stress on any of the organs and the hearts puts you at more risk of actual chronic factors, where it could be a person has an acute heart attack or becomes a rupture of that same plaque because of all the fatty foods over time that gives them a stroke. So we emphasize it. We make sure our patients come in and they get a baseline lipid panel, cholesterol check, to see where they're at, to identify the risk towards them, and if they need to be put in medications at the end point. But we always start with the lifestyle modifications on decreasing what they usually take in and go over their diet with them so they can improve those numbers over time.
Since we are talking, about the relationship or the relation between obesity, fat, and a certain disease, but would you like to say some few words about the connection of obesity and high blood pressure and fat and high blood pressure? Because we know that many of our friends, people, many of the people who are living in our neighborhood, especially in the minority community, they suffer from high blood pressure, which is a very dangerous one that when we consider the consequences of the high blood pressure over, everything. Okay.
High blood pressure is definitely an important end, and it was deemed as the silent killer for the Black community for a long time because it was being ignored. I tell all clients, all the patients that, any blood pressure that's not controlled gives you a higher risk of stroke. It's almost deemed as a 50% higher risk of having a stroke with uncontrolled blood pressure. The body's demand on itself of trying to regulate, again, the blood pressure is putting more stress on the heart. Now the heart is pumping harder to get that same volume of blood out into the circulation. We have our patients come in, we have them do their baseline blood pressure, we have them aware of what their blood pressure is and telling them that the resting blood pressure, if it's high, it's only going to go higher with activity, and that is very important to control it. We tend to definitely explain to them what the risk of strokes are, what the signs to look out for, the importance of treating high blood pressure as critical, and going to the emergency room if they're having any signs and symptoms of stroke and following forward.
Is there any link between high blood pressure and obesity? Any relationship? Do we see more high blood pressure in people who are obese versus people who are not?
Well, debate on just taking out genetic disposition, because you do have some people that just have benign essential hypertension, they just classified with it. Definitely with obesity. With obesity, it is said that if you lose a pound of weight, you drop your blood pressure by a half a point to a point. Okay. So obesity is directly proportional to high blood pressure. Okay. So if I have a person that's 10 pounds overweight and they're able to lose that 10 pounds, they significantly impact their blood pressure at least by 5 points to 7, 8 points as well.
Okay. And is there, in terms of disease also, is there any relationship or link between diabetes and obesity, or people who are overweight?
Absolutely. So with obesity and going with even morbid obesity, you're now decreasing your insulin resistance over time. That makes you more prone to be diagnosed as a type 2 diabetic. The insulin is no longer enough to supply demand of the body. The sugars and everything is not being metabolized as well, giving them more prone and risk for being classified as diabetic. And we're seeing that a lot in the obese population as well.
Very good. But we are talking about obesity, and you have been talking about you have been giving very important information. But those information that you have been giving, are they related only to adult or to young people? Is there any age limit when we're talking about obesity?
Well, we start
should they start watching or providing to the young people the proper diet or the young people should start, thinking about the lifestyle also, because we know that in New York City, we are very good in fast food and soda and all the rest that you know.
I always ask if McDonald's is the 5 basic food groups of their diet. Yes, and you have to start from young. If you teach healthy habits from young, they will continue on. Okay. If they become over time, and it's just like with diagnosing diabetes. Once you diagnose diabetes, it's already been in progress for over 5 to 10 years already. So if you could target the younger people and the younger population, you're absolutely correct, then you cut down the risk of that person as an adult having those same comorbidities. So yes, targeting the young population is definitely important.
We're talking about women obesity, but is there any other negative effect on the women's health? When we're talking about obesity, let's say reproductive system, for example, is there any correlation when a woman is pregnant and that woman is obese versus somebody who's not? Is there any risks in terms of number one for the baby and also for the mother?
Okay.
The fact that somebody is obese and being pregnant.
Okay, when you talk about the pregnant state obese female, you definitely now have a different parameters of gain weight during that pregnancy to decrease other risk factors. Yes, they have increased risk of having gestational diabetes during the pregnancy. They also have increased risk of also pre-pregnancy as far as implantation. Some patients become amenorrheic because of obesity, and it's not until they lose the weight that they get the reproductive cycle again. Some people have history of problems of implantation because of the obesity, so they're unable to get pregnant at all. During the pregnancy, you also have to watch for any risk of preeclampsia, swelling because of obesity, high blood pressure, and testing them 2 to 3 times for gestational diabetes. The sugar should not be high during a pregnancy because it totally impacts on the fetus directly and their intrauterine growth.
But and when we talk about health, most of the time we make the difference, or there are certain implication or relationship between ethnicity. Is there any ethnicity involvement in terms of obesity when we talk about black versus Spanish or versus Caucasian? Or
so that becomes environmental and culture, and yes, we tended to see more obesity in the Hispanic and black population, just because culture over time, they were heavier in frame versus the Caucasian group. We also look at body shape as far as the pear shape, where mostly the weight is between in the hips and the buttocks, where you have the apple shape where it becomes more central obesity, because that's a risk factor as well. And whereas your waist circumference over 35 inches also puts you as more risk of having those chronic conditions that could affect your health.
But we usually think when we talk about women, we see breast cancer and other type of cancer, but could obesity be also a risk factor in terms of cancer for women, or
yes,
or there is no connection at all?
There is some studies, there is some connection, because the breast is made up of fatty tissue. Also, estrogen is stored in the fatty tissue. And it was thought that even premenopausal, menopausal, with women who were more obese, they held on to that estrogen in the fatty tissue longer. That put them more at risk of other cancers in itself. So yes, there was some research and discussion there in regards to following up as far as still maintaining that weight even at menopausal state.
Very good. What type of advice you would like, you could give to the parents who are watching this show, because we know preventive medicine is the best medicine. Early we start, better it's going to be for the patient.
Yes, and prevention is key. And for the parents who have the children, I would like them to incorporate a full balanced meal and introduce the children to the spectrum of vegetables, have them used to eating vegetables, have them used to eating fruit, have them used to drinking water instead of a lot of the fruit juices and sodas that has all the concentrated sugars that put them at more risk for obesity. Everything, like I said, in moderation and following through. Exercise. Encourage the kids to get out of the house, get off of the computer, get off of the phones, go out and do some activity, whether it's baseball, whether it's basketball, whether it's running, or whether if it's just walking with them 20 minutes in the park. And the parents can incorporate that lifestyle in themselves too. Instead of watching them do it, you as well walk with them in the park and you're getting your exercise as well. It all starts from the beginning and it all starts from home, and that's important.
Very good. Doc, I know that it is not easy to get you and for you to take some time to come over. You would love to, but I know it's not possible. But this is very important. The information that you are providing to our viewers are very important. If somebody wants to get more advice in terms of obesity and other type of health condition, is there any way they can reach you? Or?
Oh, absolutely. Like again, my name is Dr. Juliet Hudson. I have a practice, and it's the internal medicine practice, and I'm located at 1336 Utica Avenue, right in the middle heart of Brooklyn, and we're between Avenue D and Foster Avenue, and my number is 718-618-5551. And they'll be happy to come by. We have brochures, we have pamphlets, everything that they need to keep their health and maintenance under control.
This is very important, very good, very good. I cannot thank you enough because, for coming over here, taking time from your busy schedule to give vital or very important information to the people in the community. This is so important. And as you know, preventive medicine is the best medicine.
Yes, it is.
And I think this is our moral obligation to make sure that we give all the information to the people who are watching, to the people in our community, for them to take care of themselves. And especially the women, they are our mothers or sisters or wife, aunt, they are so special to us. And, this is very important, and I thank you so much. And come back again.
Thank you so much for having me.
Thank you. That's all the time that we have for today's show. Thank you for being here, Dr. Hudson. I'm City Councilmember Dr. Mathieu Eugene. Thank you for watching Brooklyn Elected Official on the Big Cat TV network.
Watch this and other Brooklyn Independent Television episodes online at brickartsmedia.org/BIT.